Can children get strep throat more than once? Many parents wonder if their child can catch strep throat more than once, especially after they have recovered from it. The answer is yes, children can indeed get strep throat multiple times. This bacterial infection is caused by group A Streptococcus bacteria. Unlike some viral infections, such as chickenpox, where you usually gain lifelong immunity after one infection, strep throat does not work that way. There are several reasons why a child might experience strep throat more than once. First, there are different strains of group A Streptococcus. Being infected with one strain does not protect against others. This means that a child can get sick from a different strain even after recovering from a previous infection. Second, even if a child is treated with antibiotics, they can still be exposed to the bacteria again. This is especially common in environments like schools or daycare centers, where infections can spread quickly. Children often share close spaces, making it easier for the bacteria to pass from one child to another. Additionally, some children may be carriers of the bacteria. This means they have the bacteria in their throat but do not show any symptoms. These carriers can still spread the bacteria to others or may develop symptoms later on. In some rare cases, repeated strep throat infections could indicate an underlying issue, such as a weakened immune system. It might also happen if a child is frequently exposed to someone who carries the bacteria. However, for most children, getting strep throat more than once is simply due to ongoing exposure in their environment. Recognizing the symptoms of strep throat is crucial. Common signs include a sore throat, fever, swollen lymph nodes in the neck, and sometimes a rash. If a child shows these symptoms, it is best to consult a healthcare professional for a proper diagnosis and treatment. Antibiotics are typically prescribed to treat strep throat and help prevent complications. To reduce the risk of repeated infections, parents can encourage good hygiene practices. This includes frequent hand washing, not sharing eating utensils or drinks, and teaching children to cover their mouths when coughing or sneezing. If a child has repeated episodes of strep throat, a healthcare provider may recommend further evaluation to rule out any underlying causes. In summary, children can get strep throat more than once due to exposure to different strains, community spread, or being a carrier. While most cases are not a cause for concern, discussing repeated infections with a healthcare provider is important for proper management. Always seek professional medical advice for diagnosis and treatment.